Hello, friends. Thank you for joining the broadcast today. I am Dr. Marlon Robinson, and I'm here to talk to you about mental health and COVID 19. This is a brief presentation, and I hope that it will be a blessing to you. It's important for us to understand that health is indispensable to the quality of human life. So, the quality of life that you and I will enjoy will be dependent on the quality of our health. And so, in other words, according to the World Health Organization, good health is a state of complete physical, social, and mental well being, and not merely the absence of disease or infirmity. According to that definition, while spiritual health is missing, it is letting us know that there is no health without mental health. And so there are some conditions that while we cannot say it's a disease or infirmity, we cannot say that we're in a good state of health. For example, burnout is one of those conditions. And so again, there is no health without mental health. Let's take a working definition for mental health so that we know what we're talking about today. Mental health is a state of emotional and psychological well being in which an individual is able to use his or her cognition and emotional capabilities, function in society, and meet the ordinary demands of everyday life. In that definition, there are three key things. One, the person must be able to use his or her cognition and emotional capabilities, function in society, and meet the ordinary demands of everyday life. And so at this time, even during the COVID 19, mental health is super important. It has always been important, but especially during this time, it is super important. I'm going to give a brief overview of adult mental health in the United States. In the United States, there is almost 19% of the population with a mental illness, that approximately 47 million individuals. And females comprise 22.3% of the female population has a mental illness, and that is 15.1% of the male population. And we see that the 18 to 25 age group has the highest rate of mental illness, which is 25.8%. And these numbers are prior to COVID-19, so they are higher right now. um, Also, when we talk about serious mental illness, we see that 4.5% of the population has a serious mental illness, which is approximately about 11.2 million individuals. And we see again that females carry the higher burden with 5.7% of the female population and 3.3% of the male population. Let's talk about youth mental health, and this will include some of the numbers during at least some part of the COVID 19 pandemic. 9.7% of youth in the US have severe major depression, while the rate for those who identify as two or more race, that rate of severe depression is 12.4%. Also, 60% of youth with major depression did not receive any mental health treatment in 2017 and 2018. 60% of that population. So, in other words, three individuals out of five with major depression going untreated. And for those who had treatment, the other two that had treatment, only 27.3% of that population with severe depression received consistent treatment. And so there is an issue. And so again, we have to make sure that we are attending to the mental health needs of our youth. In September 2018, half of 11 to 17-year-olds reported having thoughts of suicide or self-harm. And in this presentation, when we're talking about youth, we're talking about those who are in 11 years to 17 years. So they report suicidal thoughts or self-harm. That is significant. And so again, we want to make sure that we're taking care of our young people. And those numbers were from Mental Health America, the state of mental health in America. We know that during the COVID-19 pandemic, because the stress and the disruption related to the pandemic has put us at increased risk for a mental illness, also increased risk for exacerbating our current mental condition or worsening our current mental health condition. It also puts us at risk or increased risk for comorbidity, which is the simultaneous presence of two or more mental conditions in a patient. According to the DSM, or what we call the Diagnostic and Statistical Manual of Mental Disorders, Volume 5, page 20, mental disorders are usually associated with significant distress in social, occupational, or other important activities. And we know that COVID-19 has created significant distress in many areas of life and has created major disruptions. And so I'll be sharing with you now some strategies on how we can mitigate the risk of the mental stress of COVID-19. One, you want to the first thing is that support each other in the family. So affirm each other, be gentle with each other, help each other, and make sure that you realize that we're on the same team. Next one, pursue an active exercise program, because what we do know is that exercise releases the happy hormone endorphins, which is very important for stabilization of mood. It also exercise also releases serotonin, which is very important for leveling out your mood. What we also know is that based on research, exercise is related to 1.5 fewer days of poor mental health in the previous month. So in other words, those who exercise 30 to 60 minutes, 3 to 4 times a day, add a 1.5 fewer days of poor mental health. So again, you want to make sure you get in exercise. Daily meditation. Meditation, you can do that with guided imagery. You can make sure it could be sunset, it could be sunrise, it could be your favorite spot, it could be you're meditating on your favorite quotation or that, those kind of things. In a randomized trial, researchers found that 8 weeks of brief daily meditation decreased negative mood state, enhanced attention, working memory, and recognition memory, as well as decreased state anxiety scores on the Trier social stress test. And so, in other words, daily meditation, brief daily meditation decreases anxiety as well. Also, seek mental health services. It's important that we seek mental health services if we are stressed out. Very important. Just like our physical pain in the body is to a medical doctor, psychological stress is to a mental health provider. Seek mental health services. Limit your consumption of negative news. You don't want to spend your entire day following the news on the COVID-19, because it will really drive you nuts, because we have a low threshold for negativity. So you want to spend your time thinking on things that are true, noble, right, pure, lovely, admirable, excellent, and praiseworthy. Also, you want to count your blessing. Learn to practice what I call the attitude of gratitude. Be appreciative of the things that you are thankful are, and focus on them, because what we do know from research is that gratitude makes us happier, increases psychological well-being, enhances our positive emotions, increases our self-worth, keeps suicidal thoughts and attempts at bay, strengthens family relationships in times of stress, enhances optimism, increases adaptive copings and social support. So right now you want to make sure that you spend some time to think and to write down, or even to just verbalize the things that you're thankful for, because gratitude literally will change your mental health. It will surprise you if you sit down and contemplate on these things. It will surprise you of the many things that you're grateful for. Thank you for joining us today, and have a wonderful day. Thank you, and thank you.